Hello, everyone, and welcome to our panel discussion from the employer perspective as we explore health and wealth in the workplace. I'm Nancy Vitale, and I am the co-founder and managing partner of Partners for Wellbeing. We are a boutique consulting firm that's dedicated to helping organizations integrate well-being into company culture. And I have spent the bulk of my career in human resources leadership roles in a variety of industries. And I recognize that these are unprecedented times that we are all navigating through, with a global pandemic, an economic downturn, and civil and social unrest that is gripping many communities across our nation. And with all of this, it puts an immense amount of pressure on employers. Employers who pre-COVID were the most trusted institution, according to the Edelman Trust Index. But during COVID, that trust has eroded a bit. And employers carry a significant responsibility to provide for the well-being of the people in their care. We're going to be exploring two facets of well-being, physical health and financial health, with the esteemed panel that's joining me today. But before I have them introduce themselves, I just invite our audience members to please engage with the chat function on your screen. We'd love to try to get to as many of your questions as we possibly can in the time that we have. And for now, I'm going to ask each panelist to very briefly introduce themselves and why they're passionate about this topic. So Sherry, I'll start with you.
Great. Thank you, Nancy. So my name is Sheryl Olson, and I have interest in the financial health industry personally and professionally. I have over 20 years of HR experience in the SaaS technology and financial services industry and have been providing health policies and programs to employees to help them with health and wealth needs to support them throughout their life stages. I currently work at a company called Wex, and I'm fortunate to lead human resources within our health division. And I'm so proud of the work that we've been doing around consumer-facing research to help educate employees and consumers on how they can save and pay for healthcare with tax-advantaged benefit programs. One thing we've learned is that millions of Americans are missing out on benefits that can help them pay for the healthcare costs, and we do have an obligation as employers to help create that awareness, educate, as well as empower consumers. And so at Wex, we've adopted financial health as a top priority that I'll be sharing more with you today.
Thanks, Sherry. Sheryl, how about you?
Hi, I'm Sheryl Simmons. I am the CEO of Three Flights HR, an advisory firm that focuses on creating high-performance cultures by connecting people strategy to business strategy. I've spent many, many years in executive and C-level HR roles, working with businesses throughout the US and Europe, most recently as the CHRO of Maestro Health. During my speaking engagements in 2018, I mentioned multiple times my prediction that in the coming 12 to 18 months, that financial wellness would become as relevant as physical and mental wellness. And here we are, and that was a pre-COVID prediction. I believe there is absolutely a connection between physical, mental, and financial health, and that we must engage in all three areas to address the whole health of our workforce.
Thanks, Sheryl. Robin?
Yes, hi everyone. I'm Robin Lykins. I'm the Chief People Officer at Oportun, and I've been in the human resources leadership field for over 25 years. Started my career in retail and also worked in a variety of different technology companies and now in financial tech. For those of you who are not familiar with Oportun, I have the great honor of working for this amazing company. It's a high-growth, mission-driven CDFI company, and we employ over 3,000 employees globally. Our workforce is made up of primarily retail and call center employees, but we also now have a growing technology organization. And I am really passionate about the topic of financial health because I've seen the positive impact that our company has had on our customers. And I've also had the opportunity to serve on a nonprofit board in which we were able to do coaching, career planning for underserved communities. And so putting these two together has really made me see the holistic person in terms of end-to-end life cycle of the employee and how important this aspect of both health, financially and physically is so important to the well-being of your employees and being able to make your company so much more productive and healthy.
Thanks, Robin. Mary?
Hi, everybody. I'm Mary Cain. I am a public health person by training. That's my background. And I've spent about 20 years building out chronic disease management programs for employers and health plans. And also working on integrating medical care, insurance benefits into the broader well-being for a population. So thinking about it from a total population health perspective. I'm currently in charge of clinical product at Castlight Health. And at that organization, at Castlight, we focus on trying to make it as easy as humanly possible for people to navigate the complexity of health and healthcare benefits. We do that by bringing together massive amounts of data to create a comprehensive profile and then create personalized recommendations for each person that link all of their benefits to them and make them all available to them as easily as possible.
That's great. Thanks, Mary. And I'm actually going to pose the first question to you. Given just your role and the amount of data that you have seen, is there any evidence that you've seen linking physical health and financial health as we get this conversation going? And, what data insights or patterns perhaps might be helpful for us to understand as we get into this notion of the role employers play and the things they should be paying attention to?
Yeah, so one experiment that we've seen over the past decade that's been playing out specifically in commercially insured populations, commercially self-insured employer populations, is high deductible health plans. So these are health plans where the employee pays out of their own pocket for the first few $1,000s before their insurance kicks in. And we know that people behave differently with regard to their access to healthcare depending upon where they fit in the wage strata. So if they've got a high deductible health plan, they can be in the same employer, same community, same benefits. And what we've seen is that if people are in a high wage category, they behave differently than people in a low wage category. For example, people in lower wage categories are more likely to delay necessary healthcare services, in particular, preventive healthcare services. We see low wage employees get 50% of preventive care. They have 4 times the numbers of avoidable hospital admissions. They have 3 times the numbers of emergency room visits when you compare them to higher wage employees. And the opportunity here from an employer perspective is to think about what can we do that can help people not delay that care? How can we help people think about continuing to get that preventive care? So the most natural thing to do is think about benefit design and the impact of high deductible health plans on that people making the trade-off of where the money is coming from and what else they'll have to prevent, or rather they'll have to give up in order to get that necessary health care.
That's fascinating. I mean, you've raised a number of important considerations from an employer perspective as we think about that wage stratification and how to then think about incentivizing or the behavior that you seek in terms of making sure those low wage earners are getting the health care that they actually need. Sherry, do you have anything that you want to maybe add to this, given your perspective?
Yeah, and so just to add on to where Mary was going, we find that if folks are financially healthy, we see that direct correlation between the quality of their life and the physical well-being. If we struggle financially, we also tend to see higher rates of anxiety, stress, and people tend to not seek that treatment due to the health issues. And so if it's not addressed, those critical health issues, it's compounded, which leads then to more serious illnesses, which then only perpetuates the financial issues. And so it certainly is a full vicious circle. Through the research that my company Wex has conducted, it was a study last year called Paying for Healthcare in America. It goes completely to the point that Mary was taking, which is people are stressed out. In fact, twice as many employees are stressed out about their finances than about their jobs. And so when we think about the implications, the financial stress is worse than stress over health concerns and relationships combined. And so that could mean that there's more people lying awake at night about the cost of expense, thinking, I have a $1,500 deductible, but only $300 in the bank, and worrying about how they're going to pay for those healthcare expenses. they're more concerned than possibly having a healthcare event that could impact their well-being. And so of concern, it's interesting because in the study, 25% of the workers also stated that they will forego healthcare services associated to any out-of-pocket expenses. From an employer standpoint, it gets alarming because those workers, if not taking care of the critical issues, have productivity engagement issues at work, which can lead to distractions, calling out of work because they're sick, doing possibly little work, or possibly even leaving work early. And so from an employer standpoint and HR standpoint, we just need to be paying attention to people's holistic lives. And I believe we have a responsibility to help employees manage their finances, which helps our culture, helps boost productivity, revenue, as well as increase retention rates.
Thanks, Sherry. A lot of factors to manage from a trade-off perspective as you think about the engagement and health and well-being of the workforce that are in your employ. Thanks for those comments. Sheryl, I'd like to bring you into the conversation. And I'm curious, if you've seen any demographic, social, economic differences, as Mary and Sherry were alluding to, that create or contribute to the negative impacts on financial and physical health.
Absolutely. There are most definitely differences that contribute. Social determinants play a crucial role in the overall wellness of an individual. And we all know that there are significant inequities in societal resources. So an example would be, let's think of an area with a food desert. People living there have to travel further and pay more to just get basic healthy food. So travel further and pay more is most definitely a negative impact. If you lack transportation, you're forced to buy local. If local means no fresh or healthy food options, you just started that physical, mental health, spin cycle. The U.S., despite spending far more on medical care than any other country in the world, continues to have poorer health outcomes than most other developed countries. There's a reason for that. But I think we also need to understand that financial health it's not a one-size-fits-all model. It isn't a specific number. It's about how each person defines financial security and having the financial freedom to make positive choices in their demographic, social, and economic circumstances. Everyone's journey is going to be unique to their situation. But of course, there are common traits, things like meeting your everyday needs and obligations, having emergency funds, that safety net that we talk about, getting out of bad debt, goal planning, but even starting with the very basics of budgeting. These are skills that so many people have never had the opportunity to learn. So yes, there are definitely differences that contribute.
Right. Thank you. Mary, anything to add? Because I know you have some interesting perspectives on social determinants.
Yeah. So we've been looking at social determinants here, and I think it's interesting because it has been something that's been so much a part of public insurance and public programs, and much less something that employers have focused on. So I think there's an opportunity for employers to be thinking about how to target different parts of their population to help people overcome what might be perceived as a stigma associated with social determinants of health and needs there. Some employers are starting to pay attention to bringing together unique and different sources of information to be able to better target different parts of their population, in particular looking at sources of stress, financial stress obviously being a huge source of stress, but also looking at job structure, amount of time people are able to take off, whether people are working swing shift. And those things that are then contributing on top of, the financial stress are then contributing to poor physical health. And what they're looking to do is really focus differently, again, in the context of benefit design, figuring out ways to seed that HSA if they can, create opportunities for somebody not to spend their own money out of pocket. And then also looking at ways to bring in some of the service providers, or creating a way of normalizing using some of these service providers that have previously only been targeted at publicly insured populations. So, making some of that a little bit more acceptable and reducing some of the stigma that's attached to some of those services. Because as we see in this context, a lot more people are in need of those services right now.
To that end, I'm gonna take an audience question here, and ask, maybe you can start us off, Mary, and if anyone else wants to chime in here. But do you believe the responsibility lies with the employer or with healthcare providers and health insurance companies?
Yeah, it's a great question. So for providers and health insurance companies, these folks are in their catchment area. They're not going to move out of their catchment area. They're going to remain part of their catchment area. And we need to think from the provider perspective, in the context of serving a community, how much you're able to serve that community, what you can do for that community so that community can remain healthy. We're seeing a very strange, if not perverse, experience right now as providers are missing out on some of their income, some of their sources of income, these larger health plans, health providers, and are struggling from a financial, stability perspective because they're not able to do some of the surgeries that would otherwise pay for other services. So that's a really interesting thing from a public health perspective. And then with regard to the employer, again, these people are your employed population. If you want to continue to have these folks be available to you in a productive way and, delivering the services that they're providing, it's not like they're going to move away, right? So I just feel like there's an opportunity really to be thinking about the long game instead of the short game here, and be thinking about how to serve that broader population in the long run.
Yeah, that's great. It's an and both, as with most things.
Yeah,
I
exactly.
think is what you're getting at. So, Robin, I want to bring you into the conversation, and I'm curious, what strategies have you employed to address the financial or physical health of employees, and where might there be overlap in the resource offerings or support that you're providing to employees in addressing these two aspects of well-being, financial and physical health?
Yeah, thanks for asking. So under regular circumstances, beyond the current situation that we're in today, our company has really been focused on providing access to free financial coaching, both to our customers and to our employees through a national program partner that we have. But we've also, on an ongoing basis, offered a variety of different types of webinars to educate our employees on equity as we became a public company last year, and 401k programs, our benefits programs. And then we also have an ongoing employee assistance fund, which is a 501c3 that provides financial assistance for employees that qualify. So these are some of the basics, but one of the things is through this current crisis and thinking about our employee population, many of our employees actually live in the communities with the customers that we actually serve and have been impacted. And in some cases, they are the only person in their family that still has a job. And we're so proud that we have been able to keep these people employed. But some of the things that we've done to address this, both with financial and physical, because it's become even more front of mind, is that we have taken the current programs and really kind of up-leveled those in a way that are more meaningful for today. But a key for us has been to really open up the communication channels and closely track the needs of our employees on a regular basis to understand how they're doing, what they're experiencing in their roles, and how we can help them both, physically and financially, given all the stress and the financial challenges that everybody's facing. So a couple of things that we did that were really focused to help us beyond some of the basics is, after listening, is we really got a good understanding that in order for our employees to continue to come to work and operate specifically in our stores and our call centers, is that we made the decision to provide some assistance for childcare so that our employees, one, could be helped financially, but also take that extra burden off of them in terms of worrying about how they were going to get some help to cover for their children while the schools are no longer in session live. So those are a couple of things that we did. And when you think about both the financial and the physical aspect, the stress and anxiety that's coming from everything that's happening. And we've really learned a lot through the process, and we're going to continue down this path and continue to keep those lines of communication open. So I think that they go hand in hand. You have to address them together because they do connect, whether it's today or a year from now. And listening is really the key, and understanding the needs of your employees.
I think that's so important. And in the circles that I've been discussing, with different employers across the globe, this notion of an ongoing employee listening strategy is so key. The frequency of the pulsing of surveys that are going out seems to have really increased through COVID and the crises that we're doing. And then the obligation to do something with that. And then thinking about these two facets of well-being as a focal point. Sherry, what from your perspective?
Yeah, I'd like to highlight a few different areas. One, certainly like Robin, we're very focused on the financial and physical health of our employees. And we have a financial pillar that's centered around employees' well-being. And it includes programs like total compensation, financial rewards. We also include the comprehensive benefit and different community programs. One program in particular that I'd like just to highlight today is that we have a Wex Compassion Fund, which is funded by employees' contributions, our board contributions, and company contributions. And so it has been a very important fund for us because it's provided relief for Wex employees through this unprecedented time to help them with critical financial needs caused by, qualified disasters or other hardships or burdens that they're facing. And so that's been an important program for us, which we developed years ago. We're really seeing the need for it at this point. And then on another aspect, to your point earlier, Nancy, employees do trust employers, and we have an opportunity to really have open dialogue and discuss finances and financial behavior at work. And so we've been spending a lot of time thinking about how do we help employees through budgeting 101 sessions, working with our vendors. We're looking at more sessions around 401k, health savings accounts, flexible spending accounts, dependent care accounts, and other financial health programs. And as we target communications, we're providing a 24/7 financial health advisor with partnership with our vendors. And these have been very popular and I would say overall appreciated programs to help people take care of their financial well-being and then better focus on their careers as well. In addition, just the last point I'd like to make is I'm fortunate because I work within our health division. And so Wex started a National Health Savings Account Awareness Day, which will be again October of 2020. We started it last year and we're looking forward to helping to educate consumers, employees about HSA because we know so many people miss out on the opportunity and there's a greater understanding and a greater dialogue that's needed. And so we're going to be definitely increasing our presence and focus with more consumer-driven stories and messages. And it'll be great just to see it grow in popularity and have more people within the industry involved.
Robin and Sherry, as you guys were articulating these different strategies that you've employed, it made me also wonder about the shift as more organizations have moved to a higher percentage of people in the virtual world. And as we've seen some of the implications of, I think, Robin, you may have mentioned just from a daycare perspective, as you think about the daycare needs of parents kind of shifting, and how does an employer think about providing for those needs differently when a lot of people are working remotely or where you might have essential workers? Are you seeing any other shifts as we think about this, more people working virtually and remotely or from anywhere versus in an office setting to the financial or perhaps physical health resources and strategies that you're employing?
Yeah, we actually, we went through a big transformation very quickly as part of this pandemic where we migrated almost 80% of our employees in our call centers to work from home, to work remote. And we had to do that, practically overnight, both for employee safety, but also to comply to some of the local standards in Mexico as part of this crisis. And so what we learned really quickly is that we also needed to teach employees how to work from home. And so we did several sessions. They were very interactive to hear from the employees around some of their challenges and to try to help develop programs and processes and tools to help them be most productive. But I also overlay the childcare aspect of it too. It was very helpful because now you have folks at home working and they have children there, and how are they going to get their work done throughout the day? And so hence the creation of the childcare program.
That's great.
And to add to that, Nancy, I would say on the Wex community side, we've really had to amp up our communication. We similarly had 100% work from home in a week. And so, with 5,000 employees global, that was no small task. Although, we did it with just a lot of leadership support and a lot of care for team members. And the one thing that we've been continuing to do through those, it sometimes has been daily communications, but certainly now we're at a weekly cadence, is a lot of webinars and webcasts where we can, again, start to address some of, again, the tools as well as the financial health and wellness programs that we have available to help people. We're finding that we're seeing with the recent landscape more telemedicine, mental health virtual visits that are very cost effective from an employer standpoint. And this shift in behavior and a workforce that's embracing the flexibility and frankly wants flexibility in the future with virtual sessions, remote working patterns. We've realized that over the past 4 months, it's changed our service and delivery. And we know that we can do this with technology and communications and leadership support.
That's great. Thank you.
Nancy, can I just add one more thing there?
Please go ahead.
So I would echo the comment about employers really making a huge effort to communicate frequently. I think that's one of the things we're seeing a lot of, and we support some of that on our platform, but on a daily basis, large employers are communicating about COVID and trying to support people working remotely. The other thing that they're trying to figure out how to do, and I think this is related to well-being generally, is how to help people stay connected and feel connected to the organization, and remain sane in the context of this complete new reality. And so a lot of what our customers have been asking for is support around engaging people from a well-being perspective. So, helping people certainly navigate healthcare and this weird world we're in now as it relates to, do you use telehealth? Do I need to go in? Who do I call? But also thinking about, how do I help people be healthy on a daily basis? How do I help people reduce stress? How do I help people exercise? I think the childcare example is a perfect one, where it's like all of a sudden there's a completely new problem that we don't have a solution for. So we definitely see employers jumping in from a, kind of broader well-being perspective as well, being something they're looking to solve for.
Yeah, that's a really good point in terms of connected. We actually started what we're calling culture pods. And it's a way of more formally scheduling time for folks to get together, and we're leveraging Zoom to do that. And people can break out into the chat rooms, and there's a topic. And we've really seen a really, really good participation. And we're figuring out how to continue to do that, even beyond this COVID crisis, because it's really brought the team together and given them a forum to connect with others that they may have not had a chance to do with that in the past.
That's great. All great perspectives. And at the risk that this may seem a little self-serving, Mary, I'm going to pose this question to you from our audience. How can employers integrate seamless access to financial well-being tools without all the hoops to jump through that can come with opening bank accounts? And others may have a perspective on this as well.
Yeah, this is hard, because I think a lot of financial well-being, and I would actually welcome, you guys know actually a lot more about this than I do, so I would welcome others to jump in here. I think that for a lot of financial wellness, financial well-being services, they're not necessarily targeted at lower wage employees. They're really targeted at almost like wealth management. And what I think was being mentioned previously is this idea of kind of starting small and starting with these sort of initial steps of developing, what's the ladder? What are the first couple of steps that somebody needs to take to get to financial health? I was thinking, as we were talking earlier, there's been a movement underway for a long time around mental health parity in the context of medical benefits. And it feels like there's an opportunity for financial health parity to be something that's considered. And I don't think the focus has been on lower wage employees or frontline employees or hourly employees. It's really been on almost in the context of the more white collar employees. So what we have what we do is very much do, single sign-on, deep integration of different services and programs, including financial health programs. And one of the challenges that we've seen, and I guess I throw this down as a gauntlet, one of the challenges that we've seen is that some of the slowest, lowest tech responses from some of these large players has been in the financial services world. That it's been harder for them to seamlessly integrate, to seamlessly share data, probably because of privacy. I'm sure there's lots of different reasons, but that ability to get somebody in and started very quickly feels like a real opportunity that's currently being missed.
And
one of the things that
will
I'm
speak to from the voice of experience that there are solutions out there that are not difficult, they're pretty painless. But one of the things that we had to step back and look at was the stigma that's attached to financial unwellness, to financial sickness that your employees have. It's kind of right there with mental health. Everybody they're dealing with it in some way, shape, or form, but they don't want to talk about it. So when you're looking for solutions, it's really important to look for solutions that remove the employer from the equation as much as possible. And when we did that, we had great success because it was the employee communicating directly with the vendor through a portal. And as the employer, we didn't know what the problem was. We didn't know how much they asked for. We knew nothing except how much type of assistance they were getting through a payroll deduction. And taking the employer out of that, I know, made a significant difference in the success of the program.
Yeah, and I also think too, not only the programs that you offer, they should be targeted to fit the population and what their needs are, but the how you deploy. So the point about taking the employer out of some, I think is super, super important, but also how do you communicate to the folks so they actually pay attention and have the time? I know for our retail employees, it's really hard for them during the day because they're on the floor to look at emails and look at the traditional ways of communicating. So what we found is that actually, having sessions and a multiple amounts of those sessions throughout the day to fit the shifts so that folks can actually be pulled off the floor and make sure that they get compensated for that. So they have the time to hear and take it as an important way to listen to what's available. And we really saw some great results as a focus area of that, and also the same for the call center. So I think the how you deploy is really important.
Thank you. All insightful comments. I'm cognizant of our time. I want to jump to a little bit around discussion that's happening among employer networks about the evolving social contract, not only because of the current health crisis, but with the additional economic downturn and racial tensions that I was alluding to at the start of our panel. And I'm curious, how do you see this shaping employee expectations about what employers need to provide employees relative to financial and physical and mental support? Robin, maybe I'll start with you on that.
Yeah, in businesses like ours, where our primary asset is our people, we've always been focused on supporting our employees so that they can do their best work in service to our mission. COVID-19 has really deepened the need of our employees in so many ways. And we've had to really think about supporting them in ways that we didn't, prior to COVID-19, as I spoke about earlier, in terms of their physical safety and their mental well-being and financial health. Our experience over the last 3 months has really demonstrated that staying tightly connected with them and, through these multiple channels that I'm talking about, and it's not just surveys, right? It's through having different forums where you can listen, smaller group sessions for people, having them being able to anonymously send a note or not anonymously. And if you keep those lines of communication open, it'll allow you to make the necessary changes, situations involved. And you get an opportunity to hear what's on their minds about all the problems that we're seeing in the world, and you can really respond to those in a way. I think that you can put them together versus trying to handle them in very specific different ways. It's kind of, like I said earlier, like the holistic approach to your employee through their life cycle while they're there. You have to be able to respond to many things, but some of those solutions can be the same, and it's just giving them a forum for them to be able to talk and share what's on their mind.
Yeah, there's a lot of interdependencies there at play.
Mm-hmm.
Sherry, what about from your point of view?
Yeah, what I see is that organizations are taking advantage of reviewing policies, including benefit plans, to have more diversity and inclusion in the programs. There's continued focus and transparency, certainly equal pay for equal work, but also for opportunities for further growth and development so people can thrive in their careers, to help them with financial health, and then also providing safe work environments for all.
That's great. And Sheryl, anything you want to add from your point of view?
Well, I will say, Robin and Sherry stated it brilliantly. I'll only add that the way businesses and their leadership work with their employees during these challenging times is going to determine how their employees work with them in the future. Employees expect us to see them as individuals, to meet them where they live. They want us to invite them to bring their authentic self to our workplace, and they'd really like it if we meant those words. So as employers, business leaders, human beings, you have to decide how important that social contract is between you and your employees. And if it's genuinely important, then it's time to stop judging and to start helping.
Thank you. So we just have a couple minutes left, and I'd like to kind of bring this to closure and just ask each of you if there's one key takeaway from this discussion, or is that you've been thinking about health and wealth in the workplace in general that you want to be sure to leave our audience with. What would that one kind of takeaway or final thought be? Mary, I'll start with you.
So as we were talking, a few words came to mind for me, and I think there are things that some employers have focused on and a lot of employers have not necessarily focused on. I love this idea of financial health parity along with mental health parity and physical health parity. And then the words that come to mind for me in the context of additional opportunities include thinking about programming and benefit design around developing equity, developing empathy, and developing resilience. And those things can mean lots of different things to different people, but it feels like there are opportunities to think about those as themes in the context of benefits we bring forward.
Yeah, it seems like in these times, care and empathy and compassion are coming to the forefront from an employer perspective. Sherry, what about you?
Yeah, my takeaway is certainly that employers do have a responsibility as we intertwine financial and physical health. And so we have an opportunity to focus on awareness, education, and empowerment for our different employees and also the consumers. And so again, that's why I'm super excited about HSA Day, because that's my personal challenge, to internalize the campaign and help people on October 15th with just more education and awareness, and help people again as they strive to kind of balance both their financial and physical health needs.
Great. Sheryl?
Well, my hope is that the folks attending today fully comprehend that the physical and emotional security that comes with financial stability is priceless. The workforce has this need, and as business owners and employers, listen, it's strategically advantageous, it's straightforward, it's pretty painless, but most importantly, it's the right thing to do to provide these programs to our employees.
Thank you. Robin, you have the last word.
Yes. So if I haven't been clear throughout my comments, is listen to your employees and act in ways that best fit your company, and do it on a regular basis. I think we've learned a ton through this crisis, and I hope that in our world, much of that learning sticks so that we can continue to be strong employers and provide great experiences for our employees and help their lives.
That's terrific. I just want to thank all the panelists for a great discussion, and I want to thank our audience as well. Thank you, and have a great rest of your day.